Well, speaking of the weather, one physician in our area is already seeing patients who are dealing with allergies. Dr. Philip Benyo specializes in internal medicine and geriatrics. He tells us how to cope with this ever-growing problem.
We're seeing allergy symptoms already because it's mainly been very wet. I'm not so sure the temperature inversion has much to do about it, but we do see a fair amount of allergies. Runny nose, itchy eyes, sometimes some difficulty swallowing. Usually symptomatic care with a non-sedating antihistamine, such as Claritin or Allegra. If you're hypertensive, I would avoid the ones that have the D after it because they may influence your pulse or blood pressure. Saline nasal spray is a great thing to consider. Neti pot use is also something that we advise. However, you start seeing the drainage getting kind of yucky, green, or have a sore throat or fever, you may have a secondary bacterial infection, so check with your doctor.
Are there any other health concerns right now, such as hoof and mouth or the usual?
You know what, that is another good question. I've been doing this as my 35th year of practice in the community, and I can tell you that it's March, April, and May based on some of the symptoms that we're seeing in our patients. Not only the allergy symptoms, we see more reflux, more GERD, more heartburn in the spring. And the other thing is we see a lot more emotional issues, anxiety and depressions, believe it or not. There's an old saying, crazy as a March hare. And the theory is that the same thing that's making the flowers bloom and the sap go up the trees, it's an exciting factor, if you will, in nature. And sometimes we can't handle that. It's a little lighter longer, lighter earlier, a little warmer, and it can be an activating agent for some of us out there. So keep in mind that spring is fraught with some medical issues.
Maybe some people have hibernated during the winter. They want to start exercising again. Can you give them some tips to not just go right into it fully and get hurt?
Right. I think exercise is going to help almost every illness, be it mental or physical. And the rule of thumb is you go low and you go slow. And you want to build yourself up, especially if you're a bear coming out of hibernation and you want to get rid of some extra bear fat. Walking, of course, is a great exercise. Some people take it to the next level and join a fitness gym, for example, get some professional instructions on how to exercise properly. Some degree of weightlifting would be in order as well, but get out there and start moving around.
Dr. Benyo talking with our Sam Lassand Jr. Now, Dr. Benyo is also the host of It's Your Health, which is seen regularly right here on SSPTV.